Good morning. Today we'll be discussing about various nutritional disorders. So nutritional disorders most commonly occurs, its manifestations mostly occurs in the oral cavity. If it is a vitamin deficiency or if it is a protein deficiency or mineral deficiency, it occurs in the oral cavity as ulcers or the papillation of tongue, etc. So it's very important to know about the various nutritional disorders and oral manifestations of it. So what is nutrition? Nutrition is the process by which the body acquires substances that it cannot produce by itself from food sources. So some substances which is required for our health is produced by the body itself. But nutrition is the process by which body acquires energy or substances which is not produced by the body itself. And nutrients are the substances that body cannot produce in adequate amount and that must be acquired from the external sources or food. So why oral cavity is susceptible to nutritional dysplasia? That is, if there is any nutritional problems or nutritional deficiencies for a patient, that will be mirrored in the oral cavity. Like if there is any vitamin deficiency, there will be after ulcers in the mouth, there will be depapillation of the tongue, there will be xerostomia, the teeth will be mobile, or there will be gingivitis, there will be increased gingival bleeding. So why oral cavity is more susceptible to nutritional dysplasia? It is because high rates of cell replacement. When there is a nutritional deficiency, there will be high rates of cell replacement, or in the oral cavity, there is high rate of cell replacement, and there is high rate of protein biosynthesis. When there is a nutritional deficiency, there is reduced immunity and change in bacterial flora. The oral microbial flora will be changed. So what are the 6 essential nutrients? There are 6 essential nutrients. They are protein, carbohydrates, fats, water, vitamins, and minerals. So what is the role of protein? Protein builds the muscles and a strong immune system. Carbohydrates, including starch and sugars, helps to give us energy. Fat gives us extra energy. Vitamin and minerals regulate the body processes, and water gives the cell shape and it acts as a medium in which the body processes occur. So today we will be discussing about various vitamins. Various vitamins, its function, how it affects the body, and what will be the result if there is deficiency of a particular vitamin. So vitamins are micronutrients which are the organic substances that occur in food in small amounts and necessary for the normal metabolic functioning of the body. There are 2 types of vitamins, fat soluble vitamins and water soluble vitamins. Vitamin A, D, E and K are called fat soluble vitamins, whereas vitamin C and vitamin B complex are called the water soluble vitamins. So first we will be discussing about the fat soluble vitamins. First one is vitamin A. Vitamin A is also known as retinol, which is the Sanskrit name of vitamin A. The sources of vitamin A are egg, cheese and dairy products, green leafy vegetables, red meat, orange or yellow colored fruits like papaya, carrot, etc. The functions of vitamin A is it helps to function the epithelium and it also helps with the integrity of the epithelium. Vitamin A is an anti-infective agent and also it's a chemopreventive agent. What is a chemopreventive agent? Chemopreventive agents are factors which help to prevent the potentially malignant disorders or malignant conditions. Vitamin A also acts as an antioxidant. Antioxidants are free radical scavengers. Free radicals cause destruction of the nasal oxygen and it causes destruction of the cells and epithelium. So, this vitamin A acts as an antioxidant and reduces the free radicals in our body. Also, vitamin A supports the skeletal growth. The really recommended dietary allowance of vitamin A is 5,000 international units. Then, what are the deficiencies of vitamin A? Vitamin A deficiencies are mostly reflected in the eye. The ocular signs are bitter spots, which is seen in the first row. That one indicated by the black arrow and the white spot seen inside the eye. Then second one is the keratomalacia, which is seen in the second picture. Then there is night blindness or nectophthalmia and conjunctival cirrhosis of xerophthalmia. That is draining of or reduced secretion in the eye. So what are the oral manifestations of vitamin A deficiency? There will be hypoplastic teeth. So we already discussed it helps in the integrity, keeps the integrity of the epithelium or integrity of the teeth. So when there is vitamin A deficiency, there will be hypoplasia of the teeth. Then there is xerostomia. Xerostomia is a reduced salivary flow and then periodontal pocket formation. So if there is vitamin A deficiency, that will affect the periodontal strength and the gingival strength, will reduce the secretions of the parotid gland, and it affects the teeth also. Second one is vitamin D, which is also known as cholecalciferol. 90% of vitamin D is produced in skin in presence of UV light. Vitamin D acts as a vitamin as well as an hormone. So the functions of vitamin D is it maintains the calcium and phosphorus level in blood, and it is also necessary in bone and tooth formation. So as dentists, vitamin D is very important for dentists. The sources of vitamin D, as we already said, UV light, dairy products, cheese, and egg. So the recommended dietary allowance is for the person with age less than 51 years, 200 international units. For 51 to 70 years old, it is 400 international units, and more than 70 years, it is 600 international units. So the deficiencies of vitamin D, first one is osteomalacia. In osteomalacia, there will be softening of the bone in adults. There will be pain in the pelvis, lower back region, and legs. The tenderness is felt in the shins and in other bones. The patient will be having a waggling gait. There will be tetany that may occur manifested by involuntary twitching of the facial muscles or by carpopedal spasm, that is known as chopstick sign. And there is spontaneous fracture. That is the function of vitamin D is to keep the strength of the bone. So in osteomalacia, the bone strength will be decreased. Second one is rickets. Rickets is seen in children. So rickets are the bone deformities in children. The main two points is craniotape and caput calcatum. The person will be having a median chest, and the groove in that region, diaphragmatic region, is known as Harrison's groove. The wrists and ankles will be thickened and enlarged. The knees will be bowed. So it's also known as knock knees, or legs will be bowed. The hockey stick deformity of long bones can be seen. The child will be having a squat belly, but he will be underweight and will be having mental retardation. So rickets is mainly seen in children, whereas osteomalacia is seen in adults. Next is oral manifestation of vitamin D. First, there will be developmental anomalies of dentin and enamel, which is commonly seen as enamel hypoplasia. So persons with a vitamin D deficiency will be having more risk of caries. When we take an IOPA of a person with vitamin D deficiency, we can see a large pulse chamber with delayed apical closure, and the person will be having malabsorption. So these are the important oral manifestation of vitamin D deficiency. Now, what are the laboratory findings of a person with vitamin D deficiency? Serum calcium will be normal or below the normal level. Serum phosphorus level will be below 4 milligram per deciliter. Normal is 4.5 to 6.5 milligram per deciliter, but it is reduced to 1.5 to 3.5 or even lower in patients with rickets or in infants with rickets. It is very reduced, very low. Now, serum alkaline phosphatase level will be elevated. Normally, serum alkaline phosphatase level is 5 to 50 Badansky units per 100 ml, but it will be elevated to 20 to 30 in mild rickets and to 60 or more in severe cases. So, serum calcium and serum phosphorus will be low and serum alkaline phosphatase will be increased. Next one is vitamin E. Vitamin E is also called tocopherol. So the sources of vitamin E is eggs, dairy products, and vegetable oils. So the functions of vitamin E is vitamin E acts as an antioxidant. We already said what is an antioxidant. Antioxidants are free radical scavengers. As like vitamin A, vitamin E also acts as a chemopreventive agent. Vitamin E is very important in immunity. It keeps the integrity of membrane, cell membrane of cells and skin membranes, everything, and it prevents sterility. So the most important function of vitamin E is it acts as an antioxidant. So the recommended dietary allowance per day is 15 milligram. The deficiencies of vitamin E is person with vitamin E deficiency will be having impaired neuromuscular function. There will be focal necrosis of the striated muscle, which will result in muscle weakness. And the person will be having degenerative neurologic syndrome. And this kids having vitamin E deficiency will be premature with hemolytic anemia at 6 to 10 weeks of age. Like it can be occurred congenitally in a premature baby. And increased platelet adhesion. So these are the main deficiencies of vitamin E. The oral manifestation of vitamin E is not that common. Next one is vitamin K. Vitamin K is also called cycloquinone. There are two types of vitamin K, vitamin K1 and vitamin K2. Vitamin K1 is called cycloquinone, whereas vitamin K2 is called mannadione. K1, the source of K1 is green leafy vegetables and milk. And vitamin K2, it is mannadione, it is normal in liver. So the function of vitamin K is helps in hemostasis. That is, helps in the synthesis of clotting factors 2, 5, 7, 9, and 10. Deficiencies of vitamin K results in gingival bleeding. So we know vitamin K deficiency causes bleeding, not only gingival bleeding, bleeding in every wound. So these are the fat soluble vitamins. So fat soluble vitamins are vitamin A, B, E, and K. A causes the function of A is to A and E act as antioxidants and chemopreventive agents, and A causes the integrity of the epithelium. And the deficiencies of A is mostly seen in the eyes as bitote spots, teratomalacia, and xerophthalmia. Vitamin D is we receive it from the sun by sun exposure, and it helps in the integrity of bone and teeth. The deficiency of vitamin D is called osteomalacia in adults and rickets in children. Next one is vitamin E. Vitamin E, as already said, is a chemopreventive agent and an antioxidant. It helps the membrane integrity and acts as a prevents sterility. The oral manifestations of vitamin E is less compared to other vitamins. Next one is vitamin K. Vitamin K is two types, K1 and K2, and vitamin K helps in clotting factor synthesis, and the deficiency causes bleeding. Now we will discuss about the water soluble vitamins. Water soluble vitamins are vitamin C and vitamin B complex. First, vitamin C. Vitamin C is called ascorbic acid. The sources are citrus fruits, peas, green vegetables, etc. The functions are it helps in the formation of collagen, formation of skin and bones. It acts as a detoxifying agent, chemopreventive agent, and anti-infective agent. So the recommended dietary allowance per day is 60 milligrams for adults, 80 milligrams for pregnant ladies, 100 milligrams for lactating mothers. So the deficiency of vitamin C is called scurvy. Scurvy causes impairment of growth and development. It also causes melanoma, that is bleeding in the stool, and hematuria, bleeding through urine. In scurvy, patients with scurvy will be having a rough and hemorrhagic skin, follicles in the thighs, legs, arms, and excessive loss of hair. There is changes in the salivary and tear glands. There will be orbital or subdural hemorrhages. These are the different manifestations of scurvy. So, oral manifestation of scurvy is known as manifestation of vitamin C deficiency is known as scorbutic gingivitis at its severity. The gingiva in patients with scurvy is called scurvy bud. That is, the marginal gingiva will be enlarged and envelops and conceals the teeth. The gingiva will be bluish red with a soft hemorrhagic, and it will bleed on slight provocation. So whenever we put a probe or something in the gingiva, it bleeds. In edentulous area, there will be no mucosal changes. So in persons with scurvy, gingiva gets secondarily infected and which results in winsel infection. So the oral manifestations of vitamin C deficiency is called scorbutic gingivitis. Now moving on to vitamin B complex. So there is vitamin B1, B2, B3, B5, B6, B9, and B12. B1 is thiamine, B2 is riboflavin, B3 niacin, B5 pantothenic acid, B6 pyridoxine, B9 folic acid, and B12 cyanocobalamin. And there is another vitamin which is known as vitamin B7 or vitamin H, which is biotic. First one is vitamin B1 or thiamine. Thiamine releases energy from carbohydrates and fat. The consumption of alcohol or barbiturates decreases the absorption of thiamine. And the sources of thiamine are raw wheat, brown sugar, brown rice, cereals, and millets, red meat, etc. Functions of vitamin B1 is it helps in the formation of RNA in ribosomes, and it helps in the metabolism of carbohydrates, fats, and proteins. Helps in impulse transmission, can act as a neurotransmitter or help the neurotransmitter to transmit for the transmission of impulse in actions. The recommended dietary allowance per day is 0.5 milligram per kilocalorie. So the deficiencies of thiamine is called beriberi. There are three types of beriberi. First one, dry beriberi. In patients with dry beriberi, they will be having paresthesia, numbness of foot, and leg cramps. In wet beriberi, there is edema of the cardiac disturbances and irregular pulse. And there is infantile beriberi. It is due to inadequate thiamine in the breast milk, which results dyspnea of the infant with cyanosis and cardiac failure. And we already said alcohol and barbiturate consumption decreases the absorption of thiamine. So this type of thiamine deficiency in alcoholics is known as Wernicke's encephalopathy. So these are the symptoms of beriberi. There is edema of the legs and the nails. There will be markings or face lines in the nails. The oral manifestations of beriberi are increased sensitivity of oral mucosa. So there will be burning mouth syndrome. For B1 deficiency, for thiamine deficiency, there will be burning mouth syndrome. and ulcerative stomatitis. There will be burning tongue and dyspepsia. Next one is vitamin B2 or riboflavin. Riboflavin is a yellow pigment. Consumption of tetracyclines and diuretics increase the excretion of riboflavin. The sources of riboflavin is milk, red meat, cheese, egg, and green leafy vegetables. Functions is it results in SMN and FAG formation. It acts as a hydrogen carrier and helps in the metabolism of carbohydrates, fats, and protein. The recommended dietary allowance is 1.5 milligram. So the deficiencies of riboflavin is first is dermatitis. It causes greasy, scaly, or reddened lesions in the skin and nasolabial folds. It causes butterfly rashes as like in SLE. And also, as like vitamin A, vitamin B2 also has eye changes. That is, there will be increased inflammation of conjunctiva in vitamin B2 deficiency. The oral manifestation of vitamin B2 is red, shiny lips with epithelial disformation. There will be angular cheilitis and cracking, and there will be glossitis, atrophy of papilla or depapillation of the tongue giving a beefy red tongue appearance. Third one is vitamin B3 or niacin. Niacin is formed from tryptophan, which is an amino acid. The sources of vitamin B3 is fish, chicken or poultry, millets and cereals, and milk. Functions of vitamin B3 is it helps in production of NAD and NADP, helps in tissue respiration, glycolysis, and fat synthesis. They are also very useful for the normal functioning of skin and mucous membrane. So the recommended dietary allowance is 6 to 15 milligrams. The deficiency of vitamin B3 is called, niacin is called pellagra or rough skin. This is also known as 4D syndrome, that is dermatitis, diarrhea, dementia, and death. The arrangement of lesions, that is dermatitis lesions around the neck, is known as castle necklace. Oral manifestation is as said, as with riboflavin, there also will be reduced papillation, that is depapillation, and there will be burning sensation on a swollen tongue with the teeth indentation, which is known as bald tongue of sandwich. The entire oral mucosa will be red and painful, which results in mucositis. And there will be profuse salivation. There will be tenderness, pain, redness, and ulceration of the interdental papillae. Next one is vitamin B5, that is pantothenic acid. So the sources are intestinal flora. It is commonly seen in the intestinal flora, millets and cereals, and red meat. The functions are it associates with the coenzyme A for mitochondrial respiration, and its energy releases by fat, protein, and carbohydrate metabolism. That is, it helps in the metabolism of fat, protein, and carbohydrates. It helps in the biosynthesis of cholesterol and porphyrin. So the recommended dietary allowance per day is 5 to 10 milligrams. And the deficiency of vitamin B5 causes food fatigue, sleep disturbances, and headache and abdominal stress. There is another entity called goose stepping in patients with vitamin B5 deficiency. That is, the patients will be having a burning feet with paresthesia, cramping of leg muscles, and impaired coordination. Next is vitamin B6 or pyridoxine. The sources of pyridoxine is, as we said, millets and cereals, pulses, nuts, egg, and liver. Functions are it helps in protein and amino acid metabolism. It aids in the conversion of tryptophan to niacin, helps in RBC regeneration, and helps in the normal functioning of nervous tissue. The recommended dietary allowance is 0.5 to 2.5 milligrams. Deficiency They resemble that of pellagra, but it is not resolved by niacin administration. So how we differentiate between the deficiencies of pyridoxine and niacin is we will administer niacin to the patient, and if it is resolved by niacin, that is pellagra, and if it is not resolved, that is the deficiency of pyridoxine. Next one is vitamin B9 or folic acid. The sources are soya bean, citrus fruit, wheat, etc. Function of folic acid is it acts as a coenzyme for the synthesis of purines and pyrimidines for the DNA, and it helps in protein metabolism. It also helps in the maturation of RBC. So the dietary allowance is 30 microgram to 45 microgram per day. And deficiency is macrocytic anemia. Oral manifestations include angular cheilitis, candidiasis, after ulcer, glossodinia, and atrophic glossitis. That is, there will be depapillation of the tongue. The deficiency causes after ulcer. The patient will be having candida infections and burning tongue. Next one is vitamin B12 or cyanocobalamin. Cyanocobalamin is used in trigeminal neuralgia successfully, and the sources are liver and intestinal flora. So, vegetarians or vegans will be having cyanocobalamin deficiency because it is not present in any of the vegetables. So, function is metabolism of nucleoproteins, DNA synthesis, RBC formation, and maintenance of myelin sheath around the nerve fibers. So, the recommended dietary allowance is 0.5 to 3 microgram, and the deficiency is pernicious anemia. Oral manifestations include atrophic glossitis. There will be bald tongue. Bald tongue means there will be total depapillation of the tongue, which is called Hunter's or molar glossitis. There will be a loss of taste because there is no taste buds or papilla present, and the person will be unable to wear dentures. So, there is a vitamin tablet called Bicosol, which it is a multivitamin tablet with vitamin B complex and vitamin C. This Bicosol contains calcium pantothenate 50 mg, vitamin B12, folic acid, vitamin B1, vitamin B2, B6, B3, vitamin C, niacin, D3, and biotin. So usually we prescribe Bicosol for the patient with a recurrent after ulcer and other vitamin deficiencies. So there is another condition other than vitamin deficiency. Excess intake of vitamin can cause hypervitaminosis. So if there is excess amount of vitamin A in a person, or it's about 1 lakh to 1,50,000 international units, which causes hypercarotinemia. This hypercarotinemia can result in anorexia, irritability, loss of weight, tenderness over the long bone, and large spleen and liver. In hypervitaminosis of vitamin D, there will be headache, nausea, vomiting, metallic taste, nephrocalcinosis or vascular calcinosis. And the person will be also having pancreatitis. In increased amount of vitamin E, there will be increased time for blood coagulation and nausea, headache, fatigue, weakness, blurred vision, flatulence, and diarrhea. If there is hypervitaminosis, vitamin K, there will be jaundice in newborn, hemolytic anemia and bilirubinemia, hyperbilirubinemia, and it blocks the effect of all oral anticoagulants. So increased hypervitaminosis of vitamin C irritates the gastric mucosa. It also gives us false positive result in glucose tolerance test, and it produces kidney stones. So these are the deficiencies, functions, and hypervitaminosis of all water soluble and fat soluble vitamins. Hope it's clear for all of you. Thank you.